feeling fine is a myth. Actually, it's a misleading thing.
So it's not about temporary tension or emotions.
Temporary stress can elevate your blood pressure because of the hormonal surge, but the true hypertension, जिसको हम blood pressure की बीमारी बोलते हैं, it is on the long term and it is decided by the diet, lifestyle, age and genetics. It can on long term damage your vital organs like kidney, heart, eyes, etc. So it's a silent killer. We need to be aware of it. Strong risk factor now. I call it like sitting is a new smoking.
Welcome, Doctor. Dr. Hitesh Shah, Senior Interventional Cardiologist and Head of Department Cardiology at Rajasthan Hospital, Ahmedabad. Director of Kahan Cardiac Clinic, Ahmedabad. Let's start here, Doctor, because now, even now, like I know people who think high BP is just, oh, थोड़ा tension था, हो गया, इसलिए बढ़ गया होगा. But medically speaking, what exactly is hypertension?
See, this is again misconception. लोगों को ऐसा लगता है कि थोड़ा स्ट्रेस के हिसाब से उनका ब्लड प्रेशर बढ़ गया है, बट वो ब्लड प्रेशर कंटिन्यूसली बॉडी में 130-80 से ज़्यादा रहता है तो वो हार्ट को लोड देता है, क्योंकि जैसे आप पानी के पाइप में पानी बहता है उस तरह से अगर उसके अंदर रेजिस्टेंस होगा, अगर उसका प्रेशर ज़्यादा होगा तो फोर्स ज़्यादा लगाना पड़ेगा पानी को बहने के लिए, तो इसकी वजह से हार्ट की आर्टरीज और वेसल्स स्टीफ हो जाती है. तो खाली थोड़ा टेंशन की वजह से ब्लड प्रेशर बढ़ गया है वो भी मीथ है. अगर आपको 130-80 से ज्यादा ब्लड प्रेशर अगर कंटिन्यूसली रह रहा है तो उसको क्रॉनिक हाइपरटेंशन हम बोलते हैं.
So it's not about temporary tension or emotions.
Yes, temporary stress can elevate your blood pressure because of the hormonal surge, but the true hypertension, जिसको हम blood pressure की बीमारी बोलते हैं, it is on the long term and it is decided by the diet, lifestyle, age and genetics.
I see. So even if you feel okay, no dizziness, no headache, things might still be like, wrong inside.
Yes, definitely. That's why we call hypertension as a silent killer. हम इसको एक silent killer बोलते हैं, क्योंकि आपको कोई symptoms, you don't feel even headache, dizziness, anything, but still if your blood pressure is high, it can on long term damage your vital organs like kidney, heart, eyes, etc. So it's a silent killer. We need to be aware of it.
Wow, that's really lands hard. I mean, we go about lives without checking, thinking, and we think, well, we are okay. But high blood pressure doesn't shout, it whispers, right, doctor? Okay, doctor. So now let's talk about food, because in India, like household food, both love, like that is basically a both love and danger. So when someone is told that they have high blood pressure, what's the first thing they need to change in their diet?
So likewise, you told this. That's very true. Food can act as a medicine as well as food can act as a poison. Our food is our culture, our habit, and comfort. The first step is to reduce the salt intake. So our standard Indian food contains a lot of more salt than what is recommended. So what is standard recommendation is to have 5 to 6 grams of salt in a day. But on an average, all Indian people are consuming almost more than 10 grams salt in a day. So that's a dangerous thing.
And it's not just the salt we sprinkle, right?
Yeah, sprinkle salt is definitely dangerous, but it's not the sprinkle salt. Whatever traditional Indian food is contains like papad, pickles, sauces, ready-to-eat mixes, chips, even bread and biscuits also contains a lot of salts, and that is also like a warning signals.
Bread. I didn't expected that, doctor.
It's very true because conventionally we feel like eating bread is healthy, but it's not. Even if you eat regular brown bread, also has a lot of sodium. So step one, read the labels, avoid the processed and packaged food as much as you can. Then what to include? Then question comes what to include. The potassium-rich food, bananas, coconut, water, spinach, Loki, tomatoes, that helps to balance the sodium potassium ratio and reduce the blood pressure.
Oh, so we don't have to starve or only eat boiled food?
No. It's not like that. We need to replace the bad food with some good quality food. So you need to not punish your taste buds. Use the spices like jeera, ginger, garlic, lemon to flavor without salt. So there are very good salt substitutes.
Okay.
There are prescribed diet called DASH diet. You can Google it, and there is suggest full of color and taste, which helps to control the blood pressure. The
Okay.
bowl of dal to roti with sabji, buttermilk, banana, a lot of green veggies that can help to reduce the blood pressure. So
Mm-hmm.
it's a desi, delicious, and heart-friendly food. So you need
Mm-hmm.
not to compromise the taste buds, but like use it in a better way.
Hmm. So food doesn't have to be sad to be healthy.
No, food doesn't have to be said. It has to be smart.
Now, doctor, I will bring up some of the questions which is like, our listeners wants to listen. My mom makes homemade mango pickle every year. Can I eat it in moderation?
Yeah, it's a very touchy question. Right? It's emotional. My mom is making the pickles, and if I don't take, yeah, I don't deny it, but like it's a small bite occasionally, it's okay. But using it daily is not a right choice. Rather, you can ask your mom to replace the pickles with some of the good homemade chutneys made with the mint, coriander, or tomato instead.
What about ghee? People say घर का घी तो healthy होता है.
Again, it's a very touchy and emotional because the consumption of ghee is very common in our Indian diet practice, and scientifically speaking, up to what 1 teaspoonful of ghee is okay to have. But if you add more like ghees, and it will increase the saturated fats, and that should be avoided. So I don't deny to just compromise your taste buds, but use everything in a moderation so that your food becomes balanced. Limit all saturated food. In the oil, also use mustard oil, groundnut oil, or the virgin olive oil.
Is coconut water really helpful?
Coconut water is jam, good source of
Okay.
potassium, so it's really helpful. But please do not mix it with the sugar syrup, etc., because coconut water is comes in the most natural form of even
Correct.
sugar as well as the good source of potassium. So I would recommend that you should promote the coconut water intake in each and every diet schedules.
I skipped breakfast. Is that harmful for blood pressure?
Yeah, that's a good question. Actually, because this is many of the time our patient ask to go for the intermittent fasting sort of thing. But skipping breakfast is not a good way to manage the blood pressure because it causes so much of fluctuation issues in your hormonal levels. So because fasting causes rise in the cortisol level and it will elevate the blood pressure. So I would recommend that you can divide your meal into the small frequent meals and don't skip the breakfast because that will uh, unexpectedly can rise in the blood pressure and cause disastrous event. So don't skip the breakfast. That is not a good choice to control the blood pressure.
Exactly. Like people used to say that people generally say that you should take a heavy breakfast and then you may like take a light dinner or something like that because we have to work for the whole day.
Yeah, that's the correct thing. You need to have like breakfast like a king, then lunch
Okay.
like a little lighter manner, and the evening meal should be ideally we prefer it to be before the sunset. You close off your evening meal, and
Yeah.
after the sunset, ideally we should not
Got
use
it.
any major meals.
I see. So consistency matters more than occasional treats.
Yeah, definitely, occasional treat. I don't deny you can take whatever as occasional treat, take a fatty food or take junk food, etc. But your everyday food matters. Occasionally taking things is not so much harmful, but for your day-to-day healthy food practice is more important, and that should be more practice. So I am here not to make you devoid of any pleasures, but to make you streamline in a day-to-day.
I will not cheat with my cheat day, sir. Okay, let's go to the moment. Most of us live such sedentary life now. Office chairs, long commutes, and scrolling on sofas. How much does that affect and contribute to the hypertension?
Strong respecter now. I call it like sitting is a new smoking.
Okay.
So sedentary lifestyle is deleterious in all the way to the even blood pressure, heart, diabetes, everything.
Mm-hmm.
And that is now is the as the 21st century progresses, this respecter is tremendously increasing
Mm-hmm.
in the era of computer and mobile phone. Everybody and this era of AI, everybody is like more in the sedentary mode, and that is very dangerous because sedentary lifestyle and sitting It's going to stiffen your arteries and increase your blood pressure, and going to damage in every way possible. So even light activity also helps. So avoid the sedentary lifestyle.
Okay.
That's it. That's the message.
Hmm. So you don't have to go for a gym membership?
No, no, no. That's a fancy thing now. For disease control, it's not required to have the gym membership. But in your day-to-day living, try to implement the fewer things which will help you. First thing, like at least spare 40 to 45 minutes for brisk walking in your day-to-day schedules, because that make it a habit. Like what way we do the brush daily, we do the bathing daily, we spend the time for the meals daily. Likewise, should have a protocolized thing that 30 to 40 minutes you need to spend the time for exercise. And if you are really not able to maintain or doing less, then in your day-to-day work where you are try avoiding the elevators, don't use the lift, climb the stairs. If you need to park the car, then park the car at little distant place and then go walking to your whatever way, whatever place you want to go. Even do light yoga, stretching, and even post meal walk for even 10-15 minutes also helps. So try to squeeze some little activity out of your busy schedule and complete your energy expenditure, and that is also going to help.
So basically, yoga helps as well.
Yoga definitely helps, but people always tell me that they don't have time to do the yoga, they don't have time to do walking, etc. Then they can manage to do the activity while on their work.
Hmm.
If you have in your office, then go and take the water by yourself. Don't ask your servant to bring the water. So
Of
that is
course.
also a small thing which helps actually.
Correct, correct. And what about the people over 60 or with knee issues?
This is again a common questions which comes to us, but there are different set of yoga, chair yogas, and there are different set of stretching exercise like pranayam, shukshma yoga that we call, and it's a matter of expenditure of energy, not exactly what activity you do. So even if you are sitting in the chair, you can have some of the set of exercises, and if you can get supervised with some of the your proper trainer, then it is also going to help. So don't accuse that if your knee problem that you cannot do this and this. And there are a lot of options and lot of alternative available. When there is a will, there is a way.
Got it, sir. I have noticed that when I take even 15 minutes walk, like after lunch, I feel better. I feel lighter. And even after dinner, like, more clear headed. So how is that? Like, is that really impactful?
That's true. That's going to be there because after a meal, if you walk, it regulates the insulin, it calms your nerves, and it reduces the blood pressure also. So rather than spending the money for expensive treatment and for weight loss, it is a free, safe, and effective medicine. Why don't you use that? Healthy lifestyle practices are a very safe, free, and effective medicine. So you utilize your lifestyle only to control your disease.
Doctor, can we talk stress and sleep? Like, because I have noticed when I don't sleep well, I'm anxious, and my body just feels like tensed.
That's a very insightful thought, and I would like to stress upon this because stress and sleep alteration is a very important risk factor for all cardiovascular disease, including the hypertension.
Okay.
So I would recommend to the listener that at least 6 to 7 hours of good quality sleep is recommended in a day.
Mm-hmm.
And most important advice for having good sleep is unplug your all device at least 1 hour before you go to sleep. All device, including your mobile phones. Another important thing to reduce the stress is to adapt to any of the spirituality which you are believing and go into the depth of it, not just like superficial going to the temple and do some worships, but try to be some insightful into the spirituality, because that will help to reduce your day-to-day stress level. Because in my opinion, what I feel, stress is not a is an unavoidable thing. Only thing what you can do is you can manage your stress, because in this competitive field, everywhere the stress is there. You need to learn to manage it. Some of the deep breathing techniques which are there also can help to elevate the stress. Some of the guided meditation, soft music. So there are a lot of things, but you need to be committed that you will not let your stress to overdrive your brain. and our health. So people getting dragged into the stress pattern, and then their hormonal cycle becomes vicious, and they land up into the so much of complicated disease pattern. But stress needs to be managed, and it needs to be goal.
Hmm. We focus so much on diet and exercise, but rest is also a therapy, isn't it?
Yes, activity is also the therapy, and rest is also the therapy. Even those who are good gym practitioners, they also advocate some of the stretching after you complete your gym activity. Likewise, when your body has done the workout for the whole day, and you require appropriate rest,
Mm-hmm.
because that is also balances your hormonal level. So
Mm-hmm.
rest is also a part of the therapy.
Exactly. Okay. So even the office going people, like they work for the whole day, they get exhausted, not by their body but by their brain. They even need rest.
They need and I would advocate the technique called power nap.
Okay.
So power nap is if you learn that technique, it is also guided in many of the, you can find so many videos for that. So power nap is a small nap which you take in between your day-to-day activity, and that will, like, even 10 minutes of that power nap can make you your
Charge.
body to feel like
Yeah.
almost 3 hours of sleep.
Okay.
So that are some of the techniques which you need to, if you are squeezing time out of your schedules, and if you're not getting, some of the people have a shift duties, etc. So they can appropriately plan in that way, so that your body should get adequate rest.
Doctor, if you have to give three golden rules to someone who is newly diagnosed with hypertension, what would you say?
See, it's my very simple message is like the newly diagnosed hypertension patient. Use your thali and your shoes in an appropriate manner to control your blood pressure. Thalis means like do the some dietary modification which are very simple and easily practically applicable, that will help you to sort out your blood pressure issue anyway, even without medicines. And use your shoes, like to plan your activity in a manner that will reduce the unstiffen your arteries and will regulate your blood pressure. And third important thing, and be in appropriate medical advice, because most of the quack advice, some of the people, some of the other pathy people, they are advocating that blood pressure medicine once started, then we cannot stop the blood pressure medicine. And at some particular, this is very small age and you should not start the blood pressure medicine, etc., etc. Myths are going. So I would strongly recommend that be in a constant with the appropriate proper consultant who is an expert in advising the blood pressure treatment and medicine, and follow them, check your blood pressure regularly and keep it under control. Thank
Okay,
you.
okay, okay. So, doctor, in this history of decade, like you have been treating to the patients. Would you like to share any of your experience in the past history, like any of the patients which you might have gone through, and you might have feel that this is something which you'll be remembering as well.
See, there are young patient. I am focusing on the patient with the young age.
Mhm.
Likewise, earlier we used to call elderly age like more than 60 years. Now we call the elderly age more than 50 years. And we are facing like epidemic of the heart problem in a younger patient.
Mhm.
So I would like to recollect one of my incidents where just now I talked about the exercise. One of my young non-person, he started with the gym, and suddenly on the second day he did some aggressive gym and he collapsed inside the gym.
Okay.
Was brought to the hospital in almost dead mode. We did the CPR of that patient and successfully he had a massive heart attack, and he was survived of the crisis. We did the angioplasty on the ventilator, and this is, I'm talking almost now 9 years down the line.
Mhm.
And that fellow has is doing well right now, and he is married, and now he is having the kids, and the kids are coming to greet me. That's
Oh,
a
wonderful.
great sigh of satisfaction. So
Yeah.
that is one incident. Another I would like to recall is like in our medical practice there are some, we don't call it miracle, but some miracle like things happening. One pregnant woman whom we treated had a valvular issue, and she had conceived after 12 years of marriage life,
Okay.
and she was told that baby should be dropped down, otherwise mother will die
Oh.
in some of the place. And we took the challenge and we did the operation on that patient. she stayed on the ventilator for 21 days and then successfully died. Both baby and mother both survived.
Wonderful.
And after, because that baby was born because of our effort, and that baby was named after my clinic, Kahan Cardiac Clinic, and
Oh,
that baby is now
that's
1.5
amazing.
year old.
That's amazing, sir.
So that's some of the very like memory
Yeah.
patients for us.
Yes, yes, yes. 100%. So now, doctor, like, one thing I would like to tell you, like, would you like to share any like one important thing for our audience to for like about hypertension, what they should do, and what is
See,
something very much important?
I would like to very much stress upon the stress component, because most of the information what I'm telling, it is everybody knows it, but they are not implementing it. It's not like that you don't know what to do, what not to do. When it comes to the level of implementation, then there are resistance comes, and there is some inertia, there is some laziness that comes.
Mhm.
And for that management of stress level, the adherence to the any of the religion, whatever you are following, any of the spirituality, whatever you're following, go into the depth of it.
Okay.
Have the full knowledge. Like,
Yeah.
try to go and peep into, because our ancient, all the scriptures, everything advocates that mind and body are very interlinked.
Mhm.
So if your mind is okay, then your body is going to react in an appropriate manner. So if you are adhering and implementing any of spiritual dimension into your life,
Mhm.
in your even professional life, your disease like body pattern, everything will have a solution. It will definitely work.
Okay.
That is my little offbeat message to the audience, that whomsoever, whatsoever God you are believing, whatsoever spiritual philosophy you are believing, don't take it lightly. Take it as a part of your regimen. Go into the depth of it, study it, and try to implement out of that.
Okay. Okay. That is wonderful. Like, we need to be internal peace and internal
Yes,
happy.
that works.
That
That's
works.
the medicine
Yes.
that helps body and soul and mind. In
Yeah.
fact,
Okay. Got it, sir. So, everyone, like, we have Dr. Sir over here, and then thank you so much for like looking at this podcast, and we will be like coming back again. So thank you so much, Doctor, for joining us and giving us so wonderful like knowledge and to the audience, to us.
thank you, Krishna, and I appreciate you people to take initiative for the this awareness campaign, because thing is like whatever we are focusing nowadays is for the tertiary care things. We're making the big hospitals and treating the diseased people, but the prevention is better than cure. So this is what we need to focus on, the prevention of the disease, and 80% of the heart issues are preventable in nature. So if we mass educate the people about the risk factors and make them aware about what can prevent the heart attack, what can control the blood pressure, what can prevent the disease, that will be the key message to the public. To add to this, I would again stress still more that we should include this health curriculum into the education, at the educational aspect. That will be very primitive, because till the children are gone to the teenage and they start eating the junk food and all that, they, if they are aware, if in their study it is shown that this is harmful things, then that can be prevented at very root level.
Oh, okay. Yes.
So that is my message to the public, that act earlier. That is going to help you on the later on.
Thank you, Doctor, for not just your knowledge but your compassion. Thank you so much. To all the listeners, don't wait for warning signs. Eat mindfully, walk with purpose, breathe, sleep, and repeat. This is Krishna signing off from Heart to Heart podcast. Thank you, everyone. Thank you so much for being so patient and taking this like knowledge and understanding entirely like how do you take care of your heart. So see you in the next podcast. Thank you. Thank you, everyone.